So just so everyone knows, I'm going to record these meetings and they're going to be posted on our website. That way, if for some reason family members can't join us, they can catch them later. So keep that in mind when you're asking questions, that it will be available to the general public. So you may not want to get too specific about your loved one's healthcare. I mean, if you're comfortable with sharing, that's fine. I just want people to be aware that this will be shared publicly. And obviously, if there's things you don't want to be known publicly, that's fine. All right, it's 4 o'clock and you were all here on time, so we'll get started. I really appreciate you guys being here today. I'm just going to start with a quick update on where we are with visits. And the COVID cases in Bennington County continue to increase. We went from a 1.7 community spread to a 3.4 community spread. So based on that and conversations with Dr. King, listening to Dr. Levine from the Department of Health, we're still going to hold off on doing indoor visits. I know it's hard with the holidays and it's a decision that keeps me awake at night. But with the community spread continuing, we're actually seeing some people in our local hospitals, none of our residents or staff. We're going to right now continue to hold off on that, but that's almost a daily conversation we have. What are we doing with that? So right now that'll continue to be on hold, but window visits will continue. We do have those set rooms for window visits for a reason, because we will not be shoveling around the building to individual rooms. We just can't possibly do that as much as I would love to. Now, as I was leaving to go to the dentist today, I saw several family members walking up to their loved one's window, which is great. But with 20 inches of snow anticipated, we won't be able to do that. So we will still have those areas, and we'll still use Mary for scheduling those. I want to let everybody know that we do have a positive case of the flu in the building, but that person is on quarantine. So and I saw that Dr. King popped in, so he can interrupt me if I get this wrong. So when we think someone has what we call acute respiratory symptoms, coughing, fever, signs and symptoms that really look like they're coming down with something respiratory, we are immediately placing them in quarantine. If they're in a room by themselves, they won't be moved. But if they're in a room with a roommate, they will be moved out. And we're going to be doing 3 tests. And I know this may seem a little crazy, but we'll talk through it. And then Dr. King can jump in here in a minute. When we see these acute onset of respiratory symptoms, we're immediately going to do a rapid flu test, which we get back very quickly. And we now have the ability to do antigen COVID tests. We get those results back in 15 minutes. Wow. And because there is still some concern on whether or not you can get a false negative or a false positive, we'll do the traditional PCR test. So while all of those tests are pending, your loved one would be in a private room. Dr. King, is there anything else you want to add to that?
No, the flu test we send to the hospital, we usually get that back in an hour or two. The antigen test we perform here, and that's completed in about 15 minutes. And the PCR test is sent either to the state lab or the hospital, and they have several labs that they may send it to, or they may do it on their own. So that test can take a day, 24 to 36, 48 hours to get that. In the interim, the ability to do the antigen test can give us an indication if COVID is here in the building, and if someone has that enables us to start contact tracing a little earlier than when we get it. COVID is all around. It's still increasing. Vermont's numbers don't compare to our neighbors, but it's still, compared to our experience thus far, it's still increasing. And it keeps knocking on the door. We deal with, staff who have COVID-related exposures on a daily basis. And so people end up quarantining and not coming to work, and and so it's a real deal. It's threatening us all. It's why it's nice to have this positive light of the vaccine that we hope to start on January 2nd. Start being, that's the day it's being administered, and then 3 weeks later in follow-up. But that's our approach to that, because we want to identify it as early as possible. As soon as we would, it would be the Department of Health would assist us with doing more screening and testing of residents on a regular basis.
Daniel, you have a
Dr.
question?
Daniel.
Yeah. So you're saying the person with the flu or somebody gets the flu, it's going to take up to 24 hours to definitely determine whether it's just the flu or whether it's COVID.
Well, people can have flu and COVID. The flu answer we generally get back within an hour or two. That goes to the hospital, and they let us know. So our on-call provider will know. We do have one case of flu. In our institutional setting, 2 influenza cases count as an outbreak. When there's an outbreak, we offer preventative antiviral oral therapy to every resident.
The Tamiflu.
The Tamiflu, and that's a major deal. I mean, that's 105 people or so to screen for kidney function. I mean, we have a table of what their last kidney function was. Some people might need to have a blood test to establish what dose they would get, but we it's a big trigger to pull, but we're halfway to pulling it with one case. And the reason it's such an aggressive response that's recommended by the CDC is because the flu, like COVID, there's a significant number of people who don't have symptoms and can transmit the disease. And so it's essential that that we identify and offer people opportunity for treatment, because like COVID, the people who are older and have multiple medical problems are at higher risk for more severe disease or mortality. With influenza happening in the middle of all this infection control, I have to say I was truly hoping we could sneak through this season without seeing influenza, but it's in the community, and we have one case, and there isn't a piece of wood in the building we haven't knocked on for both of these issues frequently. But while we're knocking, we keep talking about hand washing and testing and mask use and face mask use and full PPE use for people in quarantine and all the other measures that have helped us thus far.
With all the lockdown precautions, Melissa, that you guys have done, employee testing and everything, how did one person get the flu?
Right.
Well, we still
Dr.
have
King, I'm going to defer that to you.
we have 250 employees and vendors come in, and other than sticking everybody in an autoclave as they walk through, which is it's not a and unfortunately it's not survivable. So we when you deal with people have germs, and everything we do is about reducing risk. And so I think with a combination of luck and attention to infection control, we've really been happy. It's taken a huge toll on the visits and engagement with the community, engagement with family, and that's really thus far has been the hardest part of COVID for me personally, is the toll that all this takes. We really try to encourage as much video contact, letters, phone calls, that you can do, and I can't wait for the day that things can really truly open up again.
Yeah.
It's hard not to hug them.
Yeah, definitely.
See your grandchildren across a yard and not be able to.
Right.
But if we can get a sizable portion of the staff and population immunized, that's the beginning of the end. And
Right.
and getting things back to normal.
So with that-
So in other words, oops, I'm
Go
sorry.
ahead. No, go ahead. Sorry, didn't mean to cut you off.
So in other words, even though you don't have visits and staff and vendors all wear masks, people can still get the flu, even though you have a mask on?
Yeah. I mean, it's like, it's nothing, when it comes to humans, nothing is 100%.
Okay.
You know, because it's just the way biology works. You know, the vaccine, 95% effective.
Right,
But
yeah, that's right.
1% of people may still get COVID, although that COVID, at least in the initial studies, is less severe. If you look at the group of people who got placebo versus the people who got the disease, the 1 out of 20 that actually did get sick didn't get as sick. Actually, there's only one person who got severely ill who got with COVID, who got the vaccine, while there were about 9 times that many in the placebo group that got severely ill. So yeah, I wish there was less gray and all black and white when it comes to these kind of things. But that's why we have our education nurse, drilling people, sort of like a drill sergeant, on PPE and hand washing. I learned details of hand washing about 8 months ago that changed how I wash my hands. Based on some evidence that I saw, and so we've been really trying to spread that around.
Diane, do you have a question?
I do. I actually have 2 questions. Now, you did administer flu shots in the fall, though, is that correct?
Yes.
Oh yeah.
Yep.
Yeah.
I even tried to incentivize the staff. And I
Okay.
said if
And my
95,
second
go ahead.
My second question, if I heard Dr. King right, did you say that you'll be doing the COVID vaccine January 2nd?
Yeah.
That's the tentative schedule with CVS now, and with the booster shot three weeks later for residents. There's a consent procedure, which you need to sign consent for both doses. So as soon as we get the form, and it's a hard copy form, it'll be a triplicate form, but you'll get 2 of them, one for the January 2nd dose and the other for the January 23rd dose. And you really need 2 to get the optimal protection.
So before we go into a lot of questions about the vaccine, let me tell you what we know now, and then we'll fire away. So as Dr. King said, CVS Pharmacy will be on site January 2nd and January 23rd. The state of Vermont is only getting the Pfizer vaccine. That is a decision that was made above our pay grade. So what is going to happen is, if you go to our website under COVID information, you'll see I think it says should be posted as vaccine information. There's a fact sheet for recipients and caregivers. It's 6 pages long. It gives you what is COVID, what is in this vaccine, what are the risks of allergies. So that information is there. As Dr. King said, we will be sending out the consent. There is a sample consent form on our website. Don't fill it out and send it back, please. Wait till we make sure that that's 100% what we need. So we will need a consent, 2 of them, one for the first dose, one for the second dose. And then we will also need a copy of any insurance cards front and back. And we'll have a letter explaining all of this in the information we're going to send to you. Our understanding is that CVS Pharmacy will have the staff, the vaccine, the needles, the PPE to administer the vaccine, not only to the staff, but to our veterans and members. They will probably be going room to room. We will ensure that there's adequate monitoring. It's at least a 15-minute monitoring after the injection for side effects. And the vaccine is voluntary because it has emergency authorization and is not FDA approved. We cannot make it mandatory. But Peter and I and all of our administrative staff are basically doing everything but dancing a jig to encourage people to get the vaccine.
I did dance a jig today, by the way.
Oh, I missed it.
Good job.
I hopped from 6-foot marker to 6-foot marker down the hall. It wasn't pretty.
I'll have to get that tape. So that's what we know now. So fire away with questions.
Does Vermont have it there already, or they won't have it until the 2nd?
There were 5,600 doses in the state of Vermont currently. All they went to the UVM Medical Center. I do know that UVM is giving out doses. Rutland Regional Medical Center is giving out doses.
Dartmouth.
Yeah, Dartmouth. Yep. So I'm not
And you
exactly.
guys have been allotted how many?
We requested enough for every bed in our building, which is 138, and then roughly for 200 employees. Our census is 101, so we know that we have requested more than we actually need. As we get closer, we're anticipating that they're going to want harder numbers, but we shot
So
big.
you guys aren't sure you're going to get enough for everybody to get one.
My understanding is that when they come for the clinics, both of those days, we'll have pre-registered everybody, so they'll have hard and fast numbers. They will come with enough vaccine to do everybody.
Including
Right.
employees.
Can I ask a question? Can you hear
including
me?
Yep, go ahead.
This is Carrie, and actually it's Carrie Whalen, Margaret Whalen's daughter. So it's mandatory that the patients get the vaccine, correct?
No, it is not. It's totally voluntary for anybody.
So
Just said-
how does that work around people visiting if you have half of your patients getting it and half of your patients not getting it?
So as I told my staff, because we had weekly PCR COVID testing today, they're like, "Oh, we're gonna get the vaccine and we're not gonna have to mask and we're not gonna have to be tested." And I said, eventually, if from what I'm hearing on the news, and Peter, of course, can correct me, is it's gonna be late summer, early fall before we really see any change in daily operations, because the vast majority of the community and that quote herd immunity won't be there till then. I don't know if there's anything you want to add
Well,
to that,
Well,
Peter.
my understanding of the vaccine is that, it'll prevent people from getting the COVID, but they don't understand now is if you get the vaccine, if you're still a carrier.
Yeah, there's different endpoints in what we want the vaccine to do. The endpoint that's been proven is that can prevent a disease from the SARS-CoV-2 virus. So disease being symptoms. But we know that a big part of the contagion around this is related to the fact that there's so many asymptomatic people with no symptoms. 40 to 80% of people with it may not have any symptoms. The studies that have been completed for the vaccines that are, at the top of the list here, Pfizer and Moderna, have looked at the outcome, and they're looking at the effect on asymptomatic, but it's a much harder study to do because people don't have symptoms, and so it's harder to report. You have to depend more on either daily testing or some regimen of antigen monitoring or antibody monitoring, which is a serial blood test. Those studies are ongoing because that's it's really just as important as a endpoint. There's theoretical reasons that it should work, but as you know, science, we don't claim things that should work. You gotta, you have to prove it, and so that's information that will be forthcoming at some point here.
Okay, so
and that will.
I'm sorry. So basically you're saying that people are going to have to visit behind the shield until midsummer?
That is
Well,
my
you-
uneducated guess, and I don't know if Dr. King has something different on that.
And so if
Uh,
we decide not to get the vaccine right now, will it be offered again in May or June?
I don't
The-
know at this point.
Right. Yeah. Who knows? We don't know. Supply is short. The most optimistic report of offering it to have a supply adequate to offer it to the general population, those who have no high risk conditions and are under 65. The most optimistic reports I've heard from that are May, June, or later. But the people who make the decisions regarding visitation, and infection control measures that are done in our community and at the veterans home and nursing homes in general. You know, a lot of what they do is driven by the community prevalence. If our community prevalence was 0.01 of COVID, you know, we'd be having visits and there'd be no issue, you know, but right now we're at the peak and the worst it's been in the past 10 months. So the community prevalence is what will really drive this. So if we end up seeing that infection control measures over the next few months, and with the addition of the vaccine working itself into the population, if we really see that the community prevalence is driven down, those who provide guidance for us will begin to judiciously mitigate the measures we're doing and make things more accessible. But you're right, it's hard. If you still have a high prevalence and a high prevalence of asymptomatic disease, we have to act like everybody has it because we have no way of proving it otherwise.
All right, well, I'll talk to my family members and then get back to you guys. Thanks for the information today.
Okay, you bet.
Daniel, I see your
Melissa.
hand up. Yeah, go ahead.
When it comes to the hard copies, is that going to be mailed out or do we have to download it and print it at home?
The envelopes, so our social work staff is incredible. They went through, and any veteran or member who has never signed a consent for like the flu shot or whatever, those envelopes are on my desk. I am waiting for the consents. The minute those consents arrive, the envelopes are going to be stuffed and they're going to the post office.
Because
we
I know
will
we
send-
get
yeah.
every fall we get the
Mhm.
permission slip for the Tamiflu.
Right, for the
Right,
flu,
so-
right.
Right.
And we'll use our blast notification system. I know that the state changed it and now you get 3 of them. I actually get 6 because I get them on my personal phone and my work phone, my home phone, and my email.
Are we getting two separate? Are we getting two
Yes,
separate
you'll get
waivers?
In that one envelope, that'll be the two waivers,
there'll be
one
one-
envelope.
So there'll be one for January 2nd and then one for January 23rd in the same envelope.
And we want you to return them both
Right.
at the same time.
Okay, now the
Yep.
insurance cards, if nothing's changed, you guys already have a copy of an insurance card.
Right.
We're asking that we get an additional hard copy because Medicare numbers have changed over the course of the past year. And we want to make sure that they want front and back. And unfortunately, we usually just have front.
Okay, Melissa,
I'm
the
gonna
other thing is
Go ahead.
Rhonda has a question. I see her over there in the corner. Rhonda?
No, you already baby, you just asked. I was asking about the copy of the Medicare card.
Yeah,
Okay,
front. And the reason we're asking for that is the federal government is allowing CVS to bill Medicare for the actual injection for the staff member to be here. There will be no out-of-pocket cost to the veterans or members at all.
right.
If for some strange reason you get a bill, send it directly to me. But there is no cost.
Well, is the state being billed or is the home being billed?
We are not. So I want to make sure that my understanding is it's covered under CARES Act money.
Yeah, that's what I always thought. It was
Right.
supposed to be completely,
Right.
the government was picking up the tab and it was done.
Right. So that's why I'm saying best laid plans of mice and men, you know? And
Yeah.
I know somebody somewhere is going to get a bill. Send it to me and I will deal with it.
Well,
Thank you,
I'm
Melissa.
The
confused.
bills, Melissa, can I send them to you?
No, I only want COVID bills for this shot. that I
I've
can
seen
have.
your bills, King.
Melanie,
We don't
you
need
guys
none of
have
that. Talk about a
Melanie.
deficit.
Okay, Melanie's got a question. Go ahead.
Do we know what the side effects are going to look like?
So
Yeah,
go ahead, Peter.
okay. I'm in charge of side effects.
You are. I was just going to read off the
Yeah.
list I had, but go ahead.
Yeah, the most common side effect is fatigue. One of the positive things about the vaccine is that in the drug studies, there were no significant life-threatening side effects. Fatigue was the most common one. Headache and low-grade fever are also possible.
What about the Bell's palsy?
Well, it was mentioned, but the incidence would be so rare, it would be hard to know whether or not
Right.
that's causation.
But it's
One of the-
possible.
yeah. Oh, a lot of things are possible. When you go from an immunization that's been given to 100,000 people, and prior to its release, it had been given to about not the Pfizer vaccine, but all these which are based on the same technology have been given. The active immunization had been given to about 100,000 people. But when you scale that up to 1 million, and then 100 million, and then 300 million, and potentially 7 billion,
So many different biological systems.
other things will come up. And one of the things I've been talking about with folks, because we all do our own risk assessments, and but sometimes we don't step back and do a global risk assessment. And what I tell people is that, other things will show up. I mean, in a vaccine may end up having a 1 in a million chance of having some neuropathy or other neurologic syndrome. The potential is something is found out that perhaps 10 people die of something, 10 out of 1 million or 100 million. And then we think about that, but then we think about balancing risks. If I hear about an accident, or if you hear about an accident where someone in England dies in a car accident, do you stop driving?
Right.
Your chance of dying in a car wreck is 1 out of 100 points, or 106. Your chance of dying from a fall is 1 out of 111. My chance of dying from drowning is 1 out of 1,200. But I still go to the rec center and swim 3 times a week.
Right.
Because I know these risks, and I know these risks are small. So I really don't have any anxiety about entering into taking this, because, even if the worst outcome were to happen, the worst unexpected outcome were to happen to me, I can look down from the heavens above, hopefully, if I'm lucky, and say, with the information I had, this is the best thing to do. And we just, because sometimes we lose sight of the fact of, a risk of 1 out of 1 million, or these rare side effects, sometimes overshadows, the benefit. We have a safe vaccine and a dangerous virus. And those kind of things add up to saying, and this is the only way out of it.
Okay. Thank you, doctor.
The fact sheet that is on our website, I also put in the chat. So if you're on your screen in the bottom, there's a middle button that says chat. If you click on that, the link to the FDA thing, FDA information is there. Or if you just put in Pfizer COVID vaccine in any Google search, it'll come up. So that information is
maybe just
there.
to finish your question, Melanie, about the side effects in general, because there are some common ones, and sometimes they bother people enough where they don't go to work. The fatigue or headache or low-grade fever. Someone may end up losing a day of work, but these side effects have generally been in the first day or two, and then done. And again, obviously most people don't experience those.
Yeah. When are you getting your shot, Dave?
Can I ask?
Peter, and I will hope to get it on January 2nd, the first time, and I'm hoping the Bennington Banner is there to photograph.
Not out of it, right?
What, can I ask a question?
Sure, go right ahead.
My name's Marilyn. I'm Dave Schroeder's daughter. What's the predicted staff that are going to be taking the vaccine? Do you have an idea about
It's a
that?
great question. We don't have that. Oh, we don't have that. No.
I will tell you, that I've had, since we have a pre-registration, I've had 15 staff since Monday. And that's not counting Peter and I in that list, have come to me and said, yes, they want to do that. And I know during our weekly staff testing today, Peter spent a lot of time talking with staff and answering questions. We're not supposed to incentivize the shot because it's emergency authorization, but I may volunteer to shave my head again if I tried that with the flu shot and it didn't work, but I'm thinking I may try it again as long as it's not seen as incentivizing. Like we can't, some nursing homes are doing gift cards and giving away shirts and The AG's office is like, Melissa, stay away from that because it's emergency off. But I suppose if it's my
Well,
head,
just general, the goodness for the greater good. And I know a
Right.
lot of hospital staff are opposed to it, surprisingly so, but
Right.
it's upsetting, and just if they're dealing with our loved ones and we're trying to do the best we can and we can't, I'm guessing too, the fewer people that are vaccinated in the building is going to impact our visitation, whether it's May or June or September. It just seems like it's going to slow the process even more.
it's going
which
to
is-
our decisions based on visitation are solely based on community spread. So for
Sure.
many weeks, our weekly or daily update from the state of Vermont says the community spread for Bennington has been 1.7%. Today, it's 3.4%.
Right.
So those are the numbers that drive visitation. Because I will never, unless it's mandated by someone outside of the vet's home, I will never ask a visitor, have you had your COVID vaccine? Unless the federal government or the state of Vermont says that I need to, but that's not in our plan. But I will tell you that we are pushing as hard as we can to really encourage the staff. And I think our flu vaccine was about 70 to 75%. But I will tell you, our staff has, and they're doing it, but you'll hear, oh my God, I cannot wait till the day that I don't have to wear this mask all day, every day, or I don't have to put on all this PPE to go into their rooms. So that's kind of an initial, like, oh, really? Well, let's talk about how the vaccine can help with that.
Right, right.
Yeah. So
I would
do our
say get
best.
the colonel to shave his head, not you.
For those of you who don't know, Al is retiring at the end of the month.
No.
Yes, the big denied stamp just didn't fly. And I think, and just to kind of relate to this, part of the reason he's retiring is he has family outside of Vermont that he can't see because he works with us and he respects the restrictions so much. He's got a brand new granddaughter he hasn't even seen yet, and she's 6 months old.
That's
So there's a lot of those personal stories that, as we feel your pain about not being able to visit. My 2-year-old granddaughter knows what quarantining is. She quarantined so she could come see me for Thanksgiving. And I won't see her at Christmas because they live in we all have those stories. And, when I see her through FaceTime and want to hug and kiss her face, I know what you guys are feeling, not having seen your loved ones since March. So, but yes, he's leaving. So feel free to send him hate mail. It's okay.
Where do I send my resume for COO?
You send that to me. And we are actively recruiting. So if you know anybody.
I almost got the hairdo, almost.
I have a question about, sorry, this is Sarah. I know my
Sure.
camera's not on.
That's okay.
Okay.
Sarah Riley, Brian Riley's wife. So I don't know how a person's immediate health affects their ability to receive the vaccine. Right now, my husband has an illness he's taking an antibiotic for. If they have something like that, does that affect whether or not they will receive the vaccine on the second?
We do try to avoid an acute phase of an illness, but taking an antibiotic is not a contraindication to it. And so, we'll really look at each case where that question is raised with an eye towards saying, is there going to be any problem giving it? Because if we have a consent to administer the vaccine, we certainly want to, especially early on, because we know that it's not like we can delay it a week and then just have access to it. We just don't know what that situation is going to look like. So, if someone is 2 days into pneumonia and is still on nebulizers and oxygen and all this kind of support, we wouldn't administer it. But somebody who's being treated for urinary tract infection, is stable, and is just finishing a course of antibiotics, there's other things that are sort of more stable situations, we would favor giving it, certainly.
Okay, I agree with that plan. I have one more question, and it is about addresses to which you send these letters. As you know, I am residing in Bennington, but the mailing address you have for me is in our home in Underhill. And I'm not running up to Underhill up and down.
Actually, Sarah, I think when I looked at yours, it is your North Bennington address, but I will double check.
Okay.
So yes, I'm writing myself a note right now to double check it when I get in the office tomorrow.
maybe next week when you've had a chance to actually deal with it some, I'll kind of call and bug somebody to check for me.
Yeah, I will check in the morning because I'm hoping to have these consents by the end of the week and get them out quickly. So
it's not something we want to miss.
No, not at all. And like I said earlier, we will send out a blast notification that they're on their way. So if you don't have them within a few days, by all means, reach out to me and say, where is it?
Yeah, I'll get 6 copies of that too. Yes.
You will.
Okay.
Just like I do. Yeah, so we're trying to figure that out. The state changed it and they're like, well, what do you mean? I said, well, what happened to the click I received it so I don't keep getting the phone calls or the emails, or they're working on that for us.
Melissa, do you think if certain members opt not to get the shot, are they going to be ostracized or treated differently?
There is no, well, only people who are going to know if they receive the vaccine are the people administering it. And just like any other healthcare information, it should be confidential. And if there are issues with that, I will address it. Just like I love Pat Crossman, our director of nursing. She's great. She's like, let's get shirts for everybody who gets the vaccine. I'm like, no, you can't, because then it shows who didn't get it.
Yeah.
Her heart was in the right place. But let me look down the hall. Oh, you're not wearing the fluorescent pink shirt. You didn't get the vaccine.
Yeah.
So if you hear any of that, let us know. But this staff has been really good about confidentiality. We announced that there's a flu case, except for the staff who's directly taking care of that individual with the flu. They don't know who it is. And just like we would put someone in quarantine, new admissions, people returning from the hospital, do they have COVID or don't they? Obviously not the whole building's not in PPE, so they know we don't,
right.
But if there was any of that, I want to hear about it immediately. But I don't, just like we're not pressuring the staff, we're not going to be twisting family members' arms or treating our veterans and members differently, because
So the only time there'd be pressure is if it was mandated by the government.
Right. It will never be mandated by me.
Okay.
That's out of my.
That's not to say that bit of clinical information wouldn't be used in a clinical assessment of somebody.
Right.
If somebody was sick and just like we look at any immunization history, we'd look at that because that might increase the risk of it being COVID if someone isn't immunized. So we would use that information that way. But no, we deal with a wide spectrum of folks that have vastly different approaches across the spectrum to their health care and health interventions and Western medicine in general. And one of the things that is enjoyable about care is really trying to get to know who people are and trying to let them or their decision maker, really try to get a feel for how they want to approach their health care and manage that. And we do have special responsibilities being in an institutional setting, and we may talk about those as we're going through the decision-making process, but it's it's really up to us to really try to find uniquely how this person wants to manage their health care, and that includes their decisions about medications, vaccines, preventative medicine, that sort of thing.
I just got my jar of medical leeches from Amazon, so I think we should be good to go.
And though Peter and I haven't
At free shipping and everything.
That's great. Producer Prime. Peter and I haven't talked about it, but I am sure that for an extended period to come, if someone, even if they've had the vaccine, is exhibiting symptoms that could be COVID, we are going to test for COVID. Okay. That is not going to come off the table by any stretch of the imagination anytime soon, because like the flu shot, just because you get the flu shot doesn't mean you're not going to get the flu.
Right.
We're going to err on the side of safety as much as possible, and we're still continuing to screen staff as they come in. And even if you get the vaccine, I won't know if you got the vaccine, we'll continue to screen. And one of the things want to talk to our pharmacy about is, can we how do we split the staff up so we don't all get it on the second and then all
Yeah.
have fatigue or a low grade
Yeah.
temp that would keep us out of work for the next couple of days. So
Yeah.
those are some
Oh,
logistics
yeah.
we're working out.
Also, I've noticed that different bills that I normally get at a certain time
Mhm.
are many of them are coming in later. Are you
Mhm.
worried that these forms won't get to us and get back to you on time?
That's a little bit of it, but worst case scenario, CVS did say we could take an over the phone consent.
Oh,
In a
good.
perfect world, I would rather have something in writing,
Sure.
just because there's going to be a lot of people involved in this. There's going to be our staff, the CVS staff. So if they come to me and say, hey, did Melissa Jackson consent? Well, I think her family did it over the phone. I don't want to, if last minute gray area, we would pick up the phone and call. Dr. King and I would
Okay.
prefer the written consent.
Right. And you know that's in the mail. You just haven't
Right.
gotten it yet. So.
Right. And if it's
Okay.
getting close and we haven't received it, if I need to come in on a Saturday and sit on the front porch before this, the week before, I'll do it. We'll figure it out to make sure it happens, that you guys get the consents and that if you want
Okay.
your loved one to have it, they'll have it.
Can I hand deliver it if I need to?
You can. You can stop, call at the front door and we'll send Kiana out in the snow and to get it. If that you think that's fine too. Just make sure you bring back both because you will have two.
Yep.
I would like to just mention one other feature of the vaccine, which you may or may not have heard about, in terms of the success relative to people's ages and other associated health conditions. And whereas with the influenza shot, where your development of protection wanes as you get older and frailer, it's still helpful, but it's not as effective as someone younger and healthier. That doesn't seem to be the phenomenon with the COVID vaccine in these initial studies, which is another encouraging thing about it, is that that us old folks are still getting a robust response and protection from it. So that's another reason that it's really the very first group includes all of our patients.
Any other questions that we can answer around COVID, visitation, screening, anything?
I have a quick question.
Sure.
You said that the government's paying for the shot,
Mhm.
right?
Yes.
So what's the is the Medicaid update or Medicare update for the CVS employees who are administering it?
Yeah.
Or-
Yeah. So how CVS is getting paid, in quotes, to do this shot is they're going to be billing those individuals who have Medicare. They're going to bill people's health insurance. So one of the things I need to work out with CVS, and one of my questions I will be asking them, is we have veterans in the building where the VA pays for their care and they don't have Medicare. So what's happening? I don't want them to get a bill. So those are the things we have to work on.
And how much are they gonna charge? Because I've heard one lady went and got a COVID test and she got a bill and it was $1,500.
There is a Medicare fee schedule. So I'm assuming it's set by that. I don't know, but I can ask the pharmacy. I'll add it to our list. Because some of the other questions I have are, all right, hopefully all of your loved ones will be with us January 2nd. But if they're out at the hospital, how do we catch them? What happens if we have new admissions? What happens when we have new staff who are invariably going to come in, or they may even come in after the second clinic? What is the plan?
Yeah.
We do not have, nor can we put our hands on, nor can we afford the freezer that goes to 90 degrees Celsius. But we want to make sure that those new veterans and members and our new staff have that ability to get that vaccine. And those are the unanswered questions we don't have answers, and I don't know if the
Can tell
pharmacy
you,
knows. Yeah.
There's a company here in Somerville, they were on the news last night. They're making the negative 90 degree refrigerator. So if you need a contact, I can help you.
Okay.
I need the contact and about $45,000 from one of my, if we need to eventually get it, we will.
Just write me a check. Write me a check. Give me a PO order.
Okay, we'll work on that. So those are the questions we're asking. And if, after this, if you have questions, email myself, email Dr. King, we'll get back to you as quickly as we can. There's still a lot of logistical things that are unknown to us. And as we get more information, we'll be more than happy to share it with you. And I said it before, and I'll say it again, and I'll say it 100 times. I appreciate your understanding through all of this. You know, in my 25 years in healthcare, this has been the craziest 9 months of my career. And your understanding and your patience and your willingness to deal with the rules changing as our staff has, seems like every other day, is, you know, beyond appreciative. And I want to acknowledge the staff. We are COVID free, except for that one employee back in March, because they're washing their hands, they're wearing their masks, they are not coming to work when they're sick. They're calling us, hey, I was in my hairdresser was in contact with someone who was in contact. Should I come to work? You know, we've heard the horror stories in veterans homes across the country and other nursing homes. And, you know, it is the staff that is on the floor every day, and Dr. King reminding them to wash their hands, that we are where we are. So thank you from the bottom of my heart for dealing with the craziness, as you know, and hopefully next December we'll all be together and we'll be chatting on a Zoom. We'll be at a Christmas party, you know.
I
The
do
car
gotta
show
say,
people
Melissa-
called and go, should we plan the car show? I'm like, let's plan it. Worst cases, we have to cancel it.
Yeah, I do got to say, Rhonda and I, we get the bulletin every month, and, you know, we keep track by calling in and everything, talking to the Rhonda and Sheila and all them on Cardinal. But you guys have done an awesome job. Out of
Thank you.
all the
Yes.
homes that we hear about and know about, you guys have done fantastic. So
Yeah.
kudos to you guys. You guys deserve it. You really do.
Thank
You've done
you.
a great job
And I will
taking
share
care
that.
of our loved ones.
Thank you.
And
And I will
while,
share that with our staff.
Thank you.
yeah,
Yes,
and while we're all
wonderful.
anxious to really see our loved ones, we completely understand
you.
and want everyone to be as safe as possible. So we're thrilled about the vaccine, but we also understand that everyone needs to do their part and stay away.
Yeah.
I know
Until
that's hard, but
everybody's
thank you very
safe.
much.
That's
Yeah.
the biggest hardship. So thank you.
Thank God
I
for
have to go.
FaceTime.
Yeah.
I
Bye-bye.
have to leave. Thank
Thank
you.
you.
Thank you.
So
Yeah, I said, thank God for FaceTime. What would we have done,
I
you
know.
know, many years ago? And I mean, FaceTime just really works.
I was
So-
joking with
thought?
the staff today. I'm like, oh, these poor kids don't even get a snow day tomorrow. They have to go to school. So again, thank you. And if there's
Who'd
anything
have thought, who'd have thought when you walk in the front door of the home on the left-hand side right there, that little sign that says, sometimes the best love you can ever show is by not visiting or not
Oh,
showing
my
up, would have been a prophecy.
Yes, yes.
I always thought that sign was silly. I was like, that sign sucks.
It still does, just so you know.
Yes.
So
Thank you all again.
thank you. Reach
Yeah,
out with
thank
anything. We
you.
really appreciate it. Take care, everybody.
you.
Thanks so much.
Bye.
Thank
Thanks.
you.
Yeah.
Bye-bye.
Thank you.
Bye.
Bye.